All right. All right. So I'd like to introduce our industry professional. Katie Mora is a functional medicine certified practitioner and registered dietitian specializing in gut health, the microbiome, and nutrition. Katie focuses on the root causes of inflammation, autoimmune disease, irritable bowel syndrome, skin health, food sensitivities, among other chronic disease states. Katie is the founder of a virtual functional medicine practice, Gut Honest Truth, as well as the host of the Gut Honest Truth podcast, which is available for iTunes and Spotify listeners worldwide. And she has interviewed some of the most prominent individuals in this field. I found Katie by being a listener of her podcast, and she's a wealth of information. And I just want to say thank you for joining us and answering the call to give us all of this important information. So let's welcome her.
Hi, everybody. I can't see everyone all at once, but I'm saying hi across the board.
Well, thank you. I'll kick us off with some questions. So the style that the approach that we have tonight is just to ask some questions. Neither Nadine nor I have a lot of experience with functional medicine, but as I was saying to Katie earlier, I see a lot of functional medicine ads in my newsfeed, and I know two of my friends who have who are on this call who have used functional medicine practitioners either currently or in the past. So we're very interested to learn what you have to tell us. I think it's a new specialty, or at least it's just coming into the forefront. So Katie, what is functional medicine and how is it different from primary medicine?
Sure. So it's rather simple. I mean, functional medicine is really root cause medicine. So in traditional healthcare, many things are siloed, right? So you think of, I have a stomach problem, I go to my gastroenterologist. I have a liver problem, I go to my hepatologist. In functional medicine, we really see the person as a whole, and we try to see how we can not silo things, but intertwine them and see how they function together, sort of like a puzzle. So if we can it's sort of like dominoes, right? You can push one domino down, everything attached is gonna either improve or get better. So functional medicine is really a science-based practice that is just all about root wellness, heavily focused in lifestyle.
Okay, and so let's just say, how would somebody come to your practice versus going to a different kind of doctor? What kind of people do you see in your practice? How do I know I need to come to you?
Sure. So me particularly is just because I do specialize is slightly different than in functional medicine. We see everything from people who are just really into health and wellness and wanting to optimize their wellness, right? Prevent chronic disease. Yeah. So people who are like, I think I'm on the right track, but I could probably dive a little deeper, make sure and prevent things from occurring down the line, right? Especially if you know you have genetic issues or high cholesterol or something in the family that you're trying to prevent. In my practice, a lot of people are drawn to me that are actually chronically sick or struggling. They might not be very, very sick, but they've been struggling with GI issues for many years and seen many specialists and can't get to the bottom of it, or they've had hormonal imbalances or detox imbalances. So I tend to see people who have kind of been struggling for a while and can't really figure it out on their own, or they're not getting to the answer with their regular primary care.
And that sounds very general to me. So I'm still thinking so what do you do that's different? Do you have a different testing routine? Or are you, okay, so you're nodding.
Yeah, pretty much everything's different. So by default, and I see a question here, but so I'm not a medical doctor, so I don't, let's say, for instance, you came into thinking you may have cancer. I would not diagnose that and treat that. That would not be in my scope of practice. But in our field, we do all of the testing that pretty much a primary care would do, right? We're going to look at CBCs, CMPs, but we do what we call functional medicine advanced testing, which is can be anything. So in my practice, I do a lot of stool testing, breath testing that looks at things like your small intestinal bacterial growth. I look at urine hormone testing. So the tests actually are a little bit more in depth and involved than what you would get at your primary care. and just a lot of it is also even different, like stool test wise. If you thought you had a parasite, they might run a quick ovoparasite test at your primary care office, like a 1-day test. What I do, it looks at like everything from like every common parasite and worm and bacteria, your inflammation levels, your digestion, and it's all DNA based, so it's slightly different and a little bit more involved. So I personally rely on testing quite a lot in my practice. Not every functional medicine nutritionist does that. I'm very clinical based, so I do a lot of tests if the patient wants that, and we work a lot more on nutrition, supplements, exercise, all of that, the health behind it all, versus a pill for an ill, if you will. You know, and treating a diagnosis, we want to know why is that not functioning or optimal in the first place, and dive there. And just notoriously, most functional medicine practitioners spend quite a lot of time with patients versus that 5-10 minute checkup. I'll spend an hour or more as my initial consult with somebody and kind of dive into their whole being, if you will.
And from that initial consult, does that tell you what type of test that patient would, okay, because I was wondering, like, I wouldn't know what kind of test.
Yeah, sometimes you know ahead if they're coming in, like what you would want to start with, but I like to basically hear your whole story, right? It could be last year, it could be since you were born, what's going on, what you've tried, what the symptoms are, and that will usually guide me to say, these are all the things that might be going on and we should test, and then how can we financially make that work for you in a timeline.
So that's good. So I guess what we should probably do, because I'm listening and I'm like, could you back up a little bit and talk to us about the gut itself and how it affects your body in different ways? And then, as we move toward talking about just skin and overall health.
Especially because you are the gut honest truth. So we know you got to start there, right?
Yeah. So in functional medicine, you're actually trained, unless you're specializing. I just happen to also specialize in this. It's sort of like a when in doubt, start with the gut, because the gut is the epicenter of health. So many of you maybe have like read, even in like your Instagram feed that you were talking about, like Hippocrates talking many years ago about how everything is a disease of the gut. So in gut health, there can be an abundance of things going wrong. Kind of what I alluded to before is we're looking at everything from foods that are irritating and causing inflammation in your gut. We're looking at bacterial. So you may have heard the words microbiome, or people might be familiar with like probiotics and prebiotics and talking about those. Those are what influence the bacteria in your gut, as well as like parasites and worms, as well as how well you're producing stomach acid and digestive enzymes and bile. That all plays a significant role and can actually impact every single function in your body, from how your hormones work to how your skin looks to how your cholesterol is and your thyroid is functioning. So it actually controls or contributes to probably every health condition there is. So if your gut's not functioning well, nothing's going to function well, which is why we kind of start there. Because for example, a lot of people, especially that maybe aren't as familiar with all the tests and stuff in functional medicine, they always want to hear about food sensitivity testing, and they want to hear about like micronutrients and am I taking the right supplements or foods. And to me, those are actually like third tier testing, because let's say you have a gut problem where you're not digesting and absorbing well, you're not going to digest and absorb all those nutrients, those supplements. Do you get what I'm saying? You're not going to process anything well, so including foods. So you may have false food sensitivities. So to me, a lot of practitioners sort of do those with patients, but I think they're a waste of people's money initially, because you're not fixing the root problem.
And what do you test to find the gut health, your gut health? How do you know?
Yeah. There's quite a lot of things, but I call it a gut workup, the top 2 tests to sort of start with. I like to do both on everyone, unless I just feel the symptoms really don't match one of them. One is a comprehensive stool test. So the cool thing about what I do is almost all of the tests I do are actually done in the comfort of your own home. So I'll just ship them to your house and you do them. So the stool test is just like a 1-day collection, ship it out, FedEx or something, and you're done with it. And then and that's looking at your large intestine and kind of all the things I listed out earlier. And then there's something called a SIBO breath test. And that is it's fairly easy, but it's like a 3-hour test, and you're breathing in, you drink a little solution, you're breathing into a tube every like 20 to 30 minutes. And it's just actually collecting gas byproducts, which is looking at, do you have bacterial overgrowth in your small intestine? Your small intestine should actually not have much bacteria. It should be pretty sterile. So this condition is called SIBO, and it actually causes about 60 to 80% of irritable bowel syndrome, or IBS. So people who have something just not right in their stomach, their gut, when they come in, they're like, I'm either not going in enough, or I go too much, or I'm very gassy. A lot of them have SIBO. So I like to look at both, because that gives me the entire picture of gut health versus compartmentalizing and only working on one thing, because they're treated differently, if you will.
What are some of the symptoms, Katie, that you should I'm laughing because I just bought my very expensive probiotics that are sitting in my medicine cabinet, and I don't take it because I don't know if I need to take it. But I'm like, I think I need to. But anyway. So what are some of the symptoms that people should recognize that they really should have get tested, or that they could have a issue with their gut health?
Yep. So pretty much everything.
Maybe on the skin, because that's big.
Yeah. So acne on the skin is a big one. That there's something imbalanced. That being said, depending on where the acne is, it could be hormonal issues, food issues, hygiene issues, a lot of different things that come through there. If you have rosacea, that is a huge health problem. Very connected to SIBO and low stomach acid. There's things like eczema. I actually just did a blog and a podcast on this. If anyone wants to hear more in depth, I actually like a lot of research and teach things. But eczema, dry skin, just generally, different itchy rashes, or if anyone has ever gone to their doctor and they're like, oh, it's yeast, and here's like a, ringworm, or here's a fungal cream or something, that is all like a systemic yeast and bacterial imbalance, usually an immune system imbalance. And then just the general, people can think about, if you're not going to the bathroom every day, or if it's hard to go to the bathroom, or if you go 3 times a day, or if you see food in your stool that's not just corn, like whole corn, or it floats in the toilet when you go to the bathroom, that's not good. That's a fat malabsorption issue. If you're always burping, you're always hiccuping, if you have heartburn, that's the most diagnosed thing there is. And I don't know anyone that's not struggled with that pretty much at some point. So indigestion, heartburn, there's all signs that something is off in your gut. If you've ever been diagnosed with like an estrogen dominant situation hormonally, that can be a gut health problem.
Does everyone, sorry, there was a note in our chat. I just want to say that it's hard to hear Katie. So if you're not muted, if you wouldn't mind muting. You hear about it so much. Is this a brand new discussion, or is it just come to the forefront?
I don't think it is. I do think we're still in our infancy of knowing what we could know about the gut. Like how I said, the small intestine should be fairly sterile. Well, they're actually doing a lot of research to say, well, maybe it's not sterile, but there's just its own microbiome. Do you know what I mean? That's much less than the large intestine. So I think we just don't know. And there's a lot of research that needs to be done. But I think that the testing wasn't really there until the last few, 10, 15 years, not even, to really identify a lot of these things and start to treat them, right? So you can't really have treatments and research if you can't test it.
Well, it's kind of interesting that you even talk about the microbiome, and maybe you can talk a little bit more about that. But I work for a pharmaceutical company, and one of their drugs that they're working on right now is a microbiome medication in which they will treat IBS, I think. And it's supposed to be pretty transformative for people with that disease. But maybe can you talk a little bit about the microbiome and what that means? Like, what's the difference between the gut, which I think is really kind of a harsh word, and microbiome?
So the microbiome is just the organisms that are living within your gut. So there's trillions of organisms, which you're more bacteria than you are human. Like there are so many different things, and things we can't even test and don't test still at this point. And that kind of includes all those things I listed out. So we're having worms and parasites. Most people have all of these things. They're just not getting tested, or maybe they're not causing symptoms for you. You can have For example, there's something called Helicobacter pylori. I'm sure someone in here has heard of H. pylori or has it or been diagnosed. It's present in over 50% of the population worldwide. And it causes, a lot of people know because it causes their heartburn. So they might have been put on something like omeprazole or a PPI. It also causes ulcerations and possibly stomach cancer if left untreated. So this is something that can be, that I test and treat actually fairly regularly, but this is something that we don't dive enough in and talk about and all of that. That is part of the microbiome, right? That I can test and treat for you and connect to actually a lot of skin issues as well for people. But with that, the gut is kind of a broader term, right? That's including all those things I said, like it includes the microbiome, right? Because the microbiome is the gut, but it also includes how everything mouth to anus, right? How your bacterial flora in your mouth, it includes how well you chew and how well your stomach produces stomach acid, how well your gallbladder and your liver function for bile production so you can digest fats, how well your pancreas is producing digestive enzymes so you can digest everything, as well as like inflammatory diseases. So things that can cause diverticulitis, diverticulosis, Crohn's. There's just a very long list of things that are included in the gut. So it's how well you digest and absorb and excrete things that you're putting into your body, right? How can you utilize them? That all happens through your gut.
There's a lot of nuggets of information there. And I know that from listening to your podcast that, you could have a whole seminar on just each of those topics. And I know that I have explored reading so much about the gut in the past couple of years, but like you mentioned before, if the testing wasn't there 10 years ago, then by the time general population learns about it, maybe 5 years ago or just now. You touched on one thing, and I do want to ask the question about how our audience has expressed interest in learning more about how to make their skin look its best. And we kind of showed that as our tag for this seminar. And I do want to get to that. Can you tell us how your internal health or diet, how does that affect our skin and what's going on there?
So your skin is the mirror of internal health, right? So if there's something, and I'm not talking like a momentary sun rash or something, but if you're chronically struggling with something or having these flares or conditions, you have to dive deeper. That is not something that a topical cream or a steroid is going to permanently fix, most likely, maybe in some cases. But usually it's usually more than just the gut and the diet, but those are the best really starting places, like biggest bang for your buck. If you start to correct those, everything will correct. But you can just start with as simple as, are you not hydrating enough? Right? A lot of people do not hydrate enough. Well, you're going to get dull. Yeah, we got our waters. You're going to get dull, dry skin. You might develop eczema, all these other issues. A lot of people, for instance, are deficient in fatty acids. So you've heard of fish oil, I'm sure, or algae oil if you don't eat fish. And that is something that when I test people, I've maybe ever seen one person's be within the balance it should be of inflammatory and anti-inflammatory. Which will greatly affect the skin. So you hear your doctors, your nutritionists say, eat fish at least 2-3 times a week. Most people don't do that. And that's also not enough. So we usually have to supplement, right, to get what we need. And then you can talk about generally the basics of if you're even eating a varied high vegetable, high fiber based diet to get the nutrients that you need from your food for optimal functioning of the body, as well as skin health, right? Like vibrant, healthy, clear skin. But there's a lot of things in protein, especially as we age, right? Protein, if we don't produce collagen, we're going to have some more saggy skin, wrinkles, all of that. But food sensitivities are huge. So many people are walking around with food sensitivities, especially the way we grow food. We don't know we have these sensitivities. And you could eat, for example, right? Some people hear about gluten-free, and that's a big one, especially for skin health, or dairy is huge for skin health. And people are like, well, I cut back. I don't eat much. I eat it, a few times a week. Well, food sensitivity can take 72 hours to mount a response in your body, which means you could eat it twice a week and have terrible skin 7 days a week, right? Doesn't matter that you're cutting back for many people. If it's still there, your body still recognizes it and forms this inflammatory response to it. And that's a problem, right? So that's why people have a hard time without a nutritionist figuring out what's going on there. And they'll be like, I removed it for a couple weeks. Well, food actually has to be out for a minimum of a month to even notice that real shift. So it gets a little confusing, which is why I recommend working with a practitioner. But yeah, so the diet is really big for skin as well as the gut, because if you can't even utilize that diet, that good diet that you're trying to go out of your way to eat, right? The probiotics you're trying to take, you're not going to utilize them, meaning absorb them and the cells will use them. And you're still going to be in the same position as to if you were not eating a well-balanced diet, right? So absorbing is just as important as eating it, which is where
Eye-opening.
come in. So skin, there's so many different things, and hormones are a big part of that, especially as we're aging, right? Our hormones, especially for women, are going crazy. So hormone balance is definitely a big part, especially for acne and like dry skin is a big part for women. And I can answer any other.
I mean, how do you combat that? Because as you get older, the hormones do change. So how do you combat the dry or?
Do a lot with that. You can do a lot with hormones. So I like to use something called a Dutch test, which is a 24-hour dried urine test. You do at home, just literally going in the bathroom on different like strips of paper, and they dry and you send them out. And it's really telling. It looks at everything from like your fight or flight stress hormones to your sex hormones. And the way this differs from like if you went to your OBGYN or you went to your primary care is it actually looks way more in depth at metabolites. So like it doesn't just say this is your estrogen level. It looks at all the different types of estrogen you make, how well the estrogen's moving through your body, how well it's being detoxed out of the body, as well as like how it's playing with all the other hormones, right? Hormones are very Goldilocks. They have to be like perfect. They can't really be. Yeah. So that you can test and do quite a lot, from food and lifestyle to supplements to, if you're really honestly menopausal and really struggling, you could do bioidentical hormone replacement therapy, which can be helpful. So that's a whole other, I don't do that, but that's a whole other thing.
Do you test for cortisol, like the fight or flight hormone? And does that affect your skin? Like, does stress really affect you in a significant way?
It can, and it can definitely kind of by downstream affecting all the other hormones in the gut, right? Something to think about with stress, which I say a lot, is so for anyone who doesn't know, cortisol is something you make, and you make it in terms of momentary stress, or it can be turned on a little too long until, if it's turned on too long, eventually it's going to kind of dim out and flatline, which is not ideal either. So back in the day, right, when we're under stress or we had like a lion trying to kill us, we've gotten put in, do I fight for my life or do I run? Right. And so when that happens, your extremities are really all in brain are all that need to work, right? Am I going to run? Am I going to fight? All the blood flow, the energy that you should be using leaves your gut, leaves your hormones, leaves your fertility parts, everything, and goes so you can be in that moment of fight or flight. The problem is, evolutionarily, we have no idea the difference between fighting from a tiger trying to kill us and fighting with our husbands, fighting with our wives, right? Fighting with our bosses. We do not know the difference. So if we are constantly sitting in DC traffic and then going to work, hating our jobs, coming home, being annoyed by children, being annoyed by our husband, we are chronically stressed out. And that is going to mess up everything from gut health to your absorption, to your skin, to your sex hormones. It's a horrible cycle, unfortunately, that a lot of Americans struggle with.
I guess you just know, like when you're just off, and you know that something is like, you could feel great and then one day you just feel off, and that's when you have to look to your diet, I suppose, and have these tests. What was the name of the test that you mentioned earlier where you pee on the stick and it dries?
It's called a Dutch test. It's by Precision Analytical. If anyone goes to my website, gothhonesttruth.com, we have like a whole testing page, and you can
On that page.
pull them all. Yeah.
Yes, I wanted to put that plug in for you, so I'm glad.
They're all there. You can see how much they cost and what they're, go to the websites and check them all out and stuff like that. Inform yourself.
Good. Katie, you have given our audience so much information and things to understand and to learn more about and to research more about. I'm just wondering, what do you recommend for our audience to just, what to do next? Or You know, I don't know if there's online material for us to learn more about, or like what do you recommend for our next steps if we're already curious about this?
Yeah, so it depends a little bit what's going on for someone individually that I would direct, there's different people who are really great to follow on social media or their websites and stuff for certain conditions or their podcasts. Um, I mean, a few things I would say is like one of the, well, I guess two things that are sort of connected. One, just due to the kind of the population you told me we're focusing on, right? So anybody who, and this can be men or women, it doesn't matter, but many times it unfortunately is the woman and the women in the world. They are anyone who's like age 45 to 70 are really that population that has it the hardest, in my opinion, right now. So they are usually someone who has kids. It could be anything from young kids to, in their 20s or 30 years old. They usually have their parents are still alive and they're usually caring for their parents' health. They're starting to have, right, perimenopause, menopause, their own issues that they don't know what to do with. They don't have time to care and heal. They're usually working full time still. So they have they're just bombarded with stress, right? So change is really hard, in my opinion, for that population because it's like we want to do the big thing and have the all the changes and success from that, but we need to start small with just like even caring for yourself, and that could be focusing on food, that could be honestly stress management, that could be sleep. I would probably say sleep and stress management you should look at first, actually. But that population tends to wait until there's a problem, right? They tend to wait until I am totally menopausal and can't sleep and feel horrible, or my gut's a mess and now I have been diagnosed with thyroid disorder or cancer or something crazy that makes them want to work on their health. And my biggest advice would be don't wait, because that's when it's really hard and takes a really long time to come. You can come back from it all, but that's where the person's like, this is going to take years, to really do this properly, versus if you get some testing done now, or you work on your nutrition and all of that and get that like set in place, you can avoid a lot of this, or tolerate that stress and that sleep and all of that much better in the situations that you're in. Because I just find that's a big, then it becomes a thing where you work with a functional medicine person and you're like, I don't have time to do all these things, right? Uproot my life, my nutrition, my diet, my exercise. So I would say to focus on like stress, sleep, and nutrition if you could, and not wait until something is wrong, think of it as optimization. But yeah, stress is the biggest cause of chronic illness that there is. And that can come in all forms, from family to just stress around food and everything we're told and hear and don't know what to do with. So I would really say if you want to find either someone who specializes, so if like gut health is your thing, I mean, I personally have tons of free resources. I have the podcast is free. You can download that on apps like iTunes or Spotify, or just go to my website and it will connect you. I have lots of blogs. I have some very inexpensive ebooks that are like $10 if people are struggling with any of the conditions that I have books on. But usually I also interview, like I had mentioned earlier, a lot of people who specialize in other areas. So you can kind of go through the podcast and be like, that's something I'm interested in. I have lupus. I want to learn more about that, right? Like I have acid reflux. I want to learn more about that. And that can guide you.
Good. I just put the name of your website in the chat for everyone so that they can, thank you for sharing those resources through your website so we know where to, good. Thank you for putting it as a link. We have
so many questions.
I was just going to say, we've got a lot of questions here. I think that we should transition to that. I just want to know,
Nadine, while you're looking at the chat, I just had one come through on my text actually, and we've had several people say how interesting this is, Katie. So thank you again for being with us. And you probably raised as many questions as you answered for us. But someone did ask, they're in Texas and they wanted to know, can you treat people in Texas? Because it sounds like many of the tests are done by mail.
The only state that's really usually a problem, and it's not always, is New York. It really depends on, and if you have questions, if I can work with you, or if I work with that condition, I do actually have a contact form on my website, and you can just shoot me a message and I'll get back to you very quickly and see if we're the right fit. But yes, with that, they could definitely reach out.
All right.
New York has its own rules about tests and especially blood draws and things like that. You can't do a lot of that there, unfortunately.
So for those people that put their questions in the chat, we did want to make this interactive, and if anyone would like to unmute and ask their question, feel free to do so. Otherwise, we can just go through and make sure we've covered these topics. Would anyone like to unmute and ask their question?
I asked earlier, does your your insurance treat you the same as they would if I went to an OB or a general practitioner?
No. So most, you will find this, not everyone, and I would be cautious of the ones that do to a degree, but most functional medicine people don't take insurance for the most part. Many, like including myself, I will provide you, if you ask me at the appointments, for a super bill. So a super bill is something that you can just, you don't have to really do anything. You can download it and send it to your insurance company for possible reimbursement. For me, that's not the same for testing. I don't provide super bills for tests. That's out-of-pocket costs. But most of my patients do get reimbursed for their super bills, or if you happen to have like an HSA or an FSA card, you can often pay for any of my services with that, which is nice. So you can pay for appointments, you can pay for tests with that card.
Thank you.
So we had a very specific question, and that was having insufficient pancreas. I'm having issues with digesting food properly. How does a body develop this issue?
That can be from a bunch of stuff, like anything. So that can honestly be from long-term suppression of stomach acid, which if you hear me if you ever have listened to my podcast, you'll know I think that's stress and stomach acid are like the root cause of everything. Basically meaning one of your first things you produce is your stomach acid. That helps you digest protein, but it also stimulates your ability to produce enzymes and bile downstream. So if you live this, like H. pylori I was talking about, that actually lowers your stomach acid. So if you've had this infection you don't know about and you have low stomach acid, you may just indirectly start not producing enough enzyme production, right? In your pancreas. Some people have diabetes, right? Many people have diabetes, unfortunately, in our country. That is going to affect your pancreas, right? You are going to produce less of that because the pancreas is overworked or burnt out, because that also produces your insulin. So people have I think it's I don't even remember the exact quote or amount anymore, but it's like 2 in 3 people have insulin resistance and prediabetes and diabetes. It's kind of crazy. So that may be why, or if you have family history of anything like pancreatic cancer, that's something you want to get checked out, just to make sure everything is well functioning there. But infections in the gut can cause that. Stress can cause that. A lot of different issues. It's usually more than one thing at once.
So what you're saying is like a lot of this is just the foods we eat and the lifestyle that we have, and that you can really cure yourself with food and reducing stress, which is like everybody's.
I want to just address Pamela's couple of questions relate exactly to that. Is she's asking in the chat, which foods contribute to poor gut health, and do you have a top 3 things that we should be doing for good gut health, basically, food-wise?
Yeah, so what contributes to poor gut health is sort of, right, there's the generic answer I can give you, which is fairly true for everyone, but like high sugar processed foods, meaning anything in a package that's not a whole food, is going to negatively impact your gut and your health. Well, I would say not having enough variety in the diet, period, meaning fruits, vegetables, and which is often, right? We're creatures of habit. We eat the same vegetables, everything. So you want to work on variety. Gluten and dairy, and unfortunately in our country, so wheat, anything that's wheat, dairy, and corn aren't great for the gut. That doesn't mean everyone needs to avoid them 100% or anything. It's more finding out and working with someone, is this triggering your immune system or your inflammatory response? Because there's actually a lot of research to say everybody who eats wheat gets leaky gut. And I'm not sure if you've heard of leaky gut. I can tell you what that is, but it causes it in everybody. But the concept is it's dose dependent, right? So Nadine could eat 1 bite and feel horrible for days. I could eat a piece of bread every day and maybe have a little leakiness, but I'm doing so much else right, it kind of goes back to baseline. So leaky gut is just essentially your whole gut, your small intestine, large intestine, it's semi-permeable, meaning you eat, you absorb nutrients, right? Everything goes out into your bloodstream, and then the food matter stays in your colon. You poop it out, and life goes on. In leaky gut, you almost get like a microscopic basketball net in your gut. And so what can happen is now food particles make it through into that bloodstream, which only your bloodstream really only identifies viruses, bacteria, parasites. So when there's gluten now hanging out in your bloodstream, it's like, what is that? That must be a virus. I should go kill it. So it hyper reacts and it starts causing systemic inflammation. And that can show up different for every human being. It might be acne for one person. It might be bloating and cramping for another. It might be arthritis for someone else. So technically those foods are not great for your gut. And some of that's due to just the way we crop food now. Do you know what I mean? That's people will be like, oh, I used to eat that 40 years ago. It was fine. Well, our food is not the same that it used to be when you guys were growing up. If you're 70 or up, it's not the same food. So that would be something to check out. So basically avoiding high sugar, high carb diets for the most part, unless you need to be on it. And then top 3 things. Oh gosh, not everyone's the same, but I would say honestly, so top 3 things we should be doing for good gut health. I would probably say stress, getting your stress under control is one of the biggest things that you could be doing, because chronic stress, like I said, right, nothing's going to work well in the gut. I would also say making sure you're having a daily bowel movement. If you're not having one and you're having to rely on things, that's an issue. Because if things sit in your colon for a day or more, that's how bacteria just sits there and overgrows, right? Parasites have a feeding frenzy on the food you eat. So, and when that happens, we tend to get hormonal circulating. So like we recycle our estrogens, which isn't great for, especially for women, or if anyone, males are struggling with prostate issues, that's an estrogen issue. So stress, having a daily bowel movement. And I would probably say figure out with someone like what the right foods are for you, honestly, because you can eat a variety and not feel restricted. If you just know how 1 or 2 things make you feel, you can make a more educated decision versus following like a fad diet you heard is the right way to go. You're eating for your body specifically. You know, I could give like a million more, but
Speaking of that, there are so many diets out there. Like, and I think we're all on or tried one and they work. And then is there any diet that you really subscribe to that you think is really great, like the whole food diet or the I don't even know them all, but is there anything, and how do you create it? I guess that's where you come in. You can create a good diet plan for yourself.
So if I had to pick one diet, it's still going to be the Mediterranean diet. I don't know if that's because I'm Italian, what we're going with, but Mediterranean diet. So usually I'll say like a gluten limited, wheat limited Mediterranean plan for people. So fad diets can work and right, everybody's body genetically, and even just back to the whole microbiome thing, depending on what your gut bugs are going to control your weight, are going to control what foods you tolerate well. So it's just really, that's where that all comes into play. It's very dependent on the person's own microbiome and genetic makeup, if you will. So I don't subscribe to any one diet. Generally speaking, majority of people do well on a low glycemic index load diet, which means, right, even just think of fruit, it's how much you are producing a response to sugar that comes into your body. So that would be like saying someone who eats cereal every morning. Generally, I would say cereal is not a great breakfast. Doesn't mean you can't eat it, but it's going to be a high glycemic food for people. So it's really working with an individual to get, so food should be enjoyed. It's community, so you can enjoy what you're eating and not feel like you're on some cardboard diet that you hate, but you're also feeling well and getting nutrients is really important. So I kind of digress there, but
no, it's very helpful. And we have the questions are coming in, so this is really awesome. We only have a few minutes left, but there were 2 that go along together, so I'll just ask them. What supplements do you recommend? And because of the overload of supplement choices, which I've had this myself, I read way too much. And then you read like have turmeric or cayenne or, have garlic. And then by the time like where do you put all this stuff and how do you eat it? Like, well, how do we navigate this?
It's hard. You work with a provider. No, so
well, I mean, I think that's right.
So generally speaking, there's probably three things I would jump to as like generics for everybody, right? So 90+%, depending on the nutrient percentage of Americans are deficient in multiple nutrients. So a good multivitamin is always a great place. And that doesn't even necessarily mean you have to take it every day. Let's say you don't feel well, or you're traveling, or you're stressed. You would want to take it then, right? Or if you just like, I did not eat well today. I definitely didn't get, you're supposed to have 6 to 8 servings of vegetables a day. Most people don't do that. So you're not going to get what you need. So a good multivitamin is a great starting point. And then, like I said before, almost no one is getting enough omega-3s. So a good fish oil that has a good balance of EPA, DHA in it is really good. A great company for that is Nordic Naturals. They're one of the only ones I would recommend, because anything that's fat-based, which is going to also include the next one I talk about, fats are where toxins store, right? So if you heard of high mercury levels, that's going to be in anything that has an oil-based supplement or any toxin that it got exposed to. So if it's not a really pure company, that can be a problem, and you might just be doing yourself a disservice. So Nordic Naturals is a really reputable company. I sell these on my website too and give people access to them. So if you go on my website, you're able to also see the brands I just use, so you can kind of get a better idea. But the last one would be vitamin D. Almost no one, if you live above the Mason-Dixon line, you are not having enough. And you go to your doctor, they check your D, let's say it's 35, and they tell you you're fine because the lower limit's 30, you're not fine. It should be like 50 to 70. So being, 20 to 50 is not high enough. And even if you're in the sun every day, a lot of people aren't able to actually metabolize that D from the sun in their body and create what they need. So fish oil, vitamin D, and multivitamin are good covering your basis, if you will. And I honestly, this is just my job. I don't like to go to the grocery store or like the CVS and get most of my supplements. It's there's been a lot of, and I 100% tell you, do not get them on Amazon if you can help it, because there's research and studies that people tamper with those things. There's third-party interferences, especially if they're powders. So you may not be getting what you think you're getting. Plus, let's use the example of the probiotic. If it's on an Amazon truck, it's sitting in a warehouse, it's sitting here. Probiotics are live cultures. They're probably going to be dead by the time that they come to you. So you're just literally going to poop out your money in the toilet of nothing. It's not going to work. So I would be cautious. Look for things like USP on the label or GMP. I'll write this out. If you're going to a general store. Otherwise, there's a lot of good companies. I'll just write some of them in here for you. Which you can kind of trust almost anything that they do. I'm just writing a few out. But yeah, those are some good ones.
So Katie, we left a few questions on the table, actually. Can we write to you and get additional, and write and ask some additional questions so we can come back out to everybody? Because I know that our time is up.
I'm sorry, say that. I was reading Abby's message and I was going to respond.
Oh, wait.
I was like, yes, no, supplements period are not FDA regulated, which is why people can do whatever they want.
What about Costco? We all buy a lot from Costco.
Yeah, I personally only use things that are pharmaceutical grade, which means you have to get it through a provider.
Okay.
But they are usually third-party tested, and so they're checking it for quantity, purity, quality, all of that. So you can usually trust and they will pull it off the market if something's wrong with it. So, but you can get some, like right now, everything's a dire need. It's more like certain supplements I would really avoid other places, but there's some good ones, and you can get even like a one you can find at like a lot of stores is like Now Foods, which is fine. That one's easily, and it's inexpensive.
Well, this gives us another topic to talk about, because apparently a lot of people want to know more about supplements. I just also want to invite our audience to put in the chat if there are other topics that you'd like to know more about in the field of health and wellness. If you would like to have another live webinar on some things that you're curious about, let us know. And our goal is to give this information to you and find experts in their field to share their knowledge. I just very, very pleased. I'm thankful for all of our our guests and participants that came out tonight, that it was so engaging, and with all of this conversation in the chat. We can tell that we have an engaged audience. I'm so happy for that. Thank you, Katie, for being our very first live speaker, and you're going to hear more and more from our format. Oh, wow, we're getting a lot of thank you. A lot of
you're welcome.
interesting.
Great.
Patty, and what else would you like to say?
Well, I just wanted to say, I think there were some questions we left unanswered. There's one in particular about hormones and estrogen replacement therapy, or HRTs, which we'll follow up with Katie and then send that back out to everyone. And
You have 10
anything
minutes, I
that was
can
left
speak.
unsaid. That actually might be a topic for the next discussion, because I know us ladies talk about it all the time. Maybe
Yeah.
not the young ones, but.
Yeah.
All right. Well, thank you, everyone.
Thank you, everyone.
Thanks
Thank
for
you so much
supporting.
for joining us and making this so successful.
Thank you.
Thanks,
This was fun.
Katie. Thank you.
Thank
Thank
you.
you.
Nice
Bye,
to
everyone.
see people.
Thank you. Nice to see you.
Thanks.
Sister.
Hi, sister. I'm just going to stop recording.